Hi everyone, my name is Dr. Faisal Sharif, and today I'm going to present to you a poster on behalf of my group. The study was on metabolic syndrome is associated with risk of ischemic stroke in patients with non-valvular atrial fibrillation, a national estimate. The primary objective of this study was to find out the prevalence of metabolic syndrome in patients with acute ischemic stroke, especially among those who had non-valvular atrial fibrillation. At the same time, our secondary objective of this study was to identify whether the various components of metabolic syndrome predict the risk of acute ischemic stroke independently, and thereafter compare our findings to the traditional chest to vest score, which we normally use to predict the risk of acute ischemic stroke. We used the cross-sectional study to identify a cohort of patients who are hospitalized with non-valvular atrial fibrillation. And the study size was taken between the years 2008 to 2017. At the same time, we used ICD-9 and ICD-10 codes to identify patients who had acute ischemic stroke, patients who had a secondary diagnosis of metabolic syndrome, as well as patients who had the various components of chest to vest score among those who were admitted due to the non-valvular atrial fibrillation. And finally, we used weight analysis using multivariable survey logistic regression to evaluate the predictive potential of metabolic syndrome and its components, and also to compare them with the chest to vest score for acute ischemic stroke. We therefore got quite a number of hospitalizations in the study of around 33,462,134 hospitalizations of patients with non-valvular atrial fibrillation. And among these patients, 2.9% of hospitalizations were due to acute ischemic stroke. And furthermore, amongst the patients who had acute ischemic stroke and were hospitalized, the prevalence of metabolic syndrome was 0.16%. And from this, we found out that the high triglyceride levels and low HDL levels, which are components of metabolic syndrome, actually independently predicted a high risk of acute ischemic stroke. Therefore, we came to a conclusion, and actually a question as well for the future studies, whether adding these two components, high triglyceride and low HDL levels, to be part of the chest to vest score in order to predict the risk of acute ischemic stroke, and whether the use of anticoagulants in such patients would actually help mitigate the risk of acute ischemic stroke. Thank you very much.